Hi, welcome back. Let's talk about blood pressure now. Okay, so some basic terms, systolic pressure and diastolic. Systolic pressure is the maximum pressure during systole or during contraction. So again, on the left is our picture of the pressure gradient. So the systolic pressure is the maximum pressure. And it looks like it's about 120. And the diastolic pressure is the lowest pressure during diastole in the heart, or in the aorta. That's where we're measuring blood pressure, is in the blood vessels, not in the heart. So the lowest pressure during diastole is here. And that looks like it's, maybe 78 or so. So maybe 78 millimeters of mercury and 120 millimeters of mercury. So systolic is always the higher of the two. And when blood pressure is reported, it's systolic over diastolic, 120 over 78 in this case. The figure on the left is just a different way of showing the pressure curve. So the maximum pressure, remember that the red line is the aorta. So there's our aortic pressure. And the green line is the ventricular pressure. Well, we're just watching the pressure in the aorta for blood pressure, because that's where we're measuring it. And the maximum pressure during systole, let's say again, is about 128 or 120. So this is our systolic. And our minimum pressure in the aorta is right about here. So there is our diastolic again, and it's about 78. And systolic is approximately 120. So different ways of looking at it. And we've seen this figure before. Okay, let's go to, a couple other terms on this slide. The pulse pressure is the difference between the high and the low. The systolic minus the diastolic is our pulse pressure, which would be sort of this. So that would be our pulse pressure, and the mean, in this case arterial, our average blood pressure, is somewhere in between. So if you're dealing with a mean or an average, you know that it's going to be somewhere between the high and the low. So if you were calculating a mean arterial pressure and you came up with a number like 60, well, that's down here. 40, so there is 60. That would make no sense for an average blood pressure. Conversely, if you came up with a mean arterial pressure of 180, that would make no sense. So just do a sort of a logic check. If you have to calculate a mean arterial pressure, it needs to be somewhere between the two. And here is the average. This is what they're showing as the mean arterial pressure. So the next slide, I think we look at a formula to estimate that. So, yeah, here we go. Some practice for blood pressure. So what is the pulse pressure? Well, you might start by writing the definition if it helps. Pulse pressure equals the high minus the low. So systolic minus the diastolic. And that was, what did we say, 120 minus, let's keep it on, let's go to 78, minus 78, and so that would be 42. 42 millimeters of mercury. That's the pulse pressure. Systolic minus diastolic, assuming that my numbers are good, that my subtraction is good. So what's the mean arterial pressure? Here's a formula that I think is easy to remember. So mean arterial pressure. First of all, let's just look at the diagram and sort of think about it for a moment. The mean arterial pressure is this line. That's our map. Well, just looking at it, it's going to be greater than the diastolic by a little bit. So it's going to be a fraction of this pulse pressure. Because remember, this pulse pressure is the difference between the systolic and the diastolic. So a formula that makes sense is let's just take the diastolic and then we'll add this amount to it. And that's approximately 1/3 of the pulse pressure if you just divided the pulse pressure into thirds. So we'll take the diastolic and we'll add 1/3 extra of the pulse pressure, and that'll put us right about there. So the formula is diastolic plus 1/3 of the pulse pressure. So it's, what did we say our diastolic was? 78. 78 plus 1/3 of our pulse pressure, which we said was 42. So plus 1/3 of 42. So you could just rewrite that, right, as 78 plus 42 divided by 3. And where's my calculator? I had it for a different number, but I just changed it on the fly. So you're probably already done with this by now. So we are going 42 divided by 3. Well, if I could type, it would help. Okay. 14. If I knew my 14 multiplication facts, I'd probably have seen that. So it's 78 plus 14. So that gives us what? 78 plus 14, 12,892. That's our MAP. And that's in millimeters of mercury. Okay, not hard. Does that look reasonable? Is it somewhere between our minimum and our maximum? Well, our diastolic was 78. Systolic is 120. Yeah, it seems reasonable. So if our math was right, we'll go with it. Okay? All right. Well, that was fun. Here are a number of factors. There are 6 of them that I want to introduce you to. These are factors that affect blood pressure. So let's just work through them. Well, one thing, of course, that affects blood pressure is the cardiac output. And you need to know this formula. I think we've already done it. It's heart rate times stroke volume, and you need to keep the units right. So for example, heart rate is always going to be beats over minutes. And stroke volume is always going to be milliliters over beat. 1 beat. How much blood is ejected with each beat of the heart. Okay, so we've done that one. Another factor that affects blood pressure is compliance. And compliance is a general term for how flexible something is, how elastic the arteries are. And the disease of arteriosclerosis results from a lack of compliance. Arteriosclerosis is literally hardening of the arteries. It results from, among other disease processes, a buildup of calcium in the cell walls. Too bad we don't have access to the cadaver this quarter, because when you, at least on the last one, I haven't seen the aorta on this new cadaver, but on the last one, the aorta was hard, and if you squeezed it between your thumb and finger, it was hard, and if you squeezed hard enough, it would crack, it would crunch, and you could hear it. It sounded like you're breaking up little cornflakes. That was calcium in the walls of the artery. That person had arteriosclerosis at the time that they died. So how does that affect blood pressure? Well, increased hardening, loss of compliance, and that increases the resistance to the blood flow. The blood vessels need to be flexible. When they're not, when they're rigid, it's harder for the heart to pump blood through there. They don't expand or contract, and it results in hypertension. But the heart has to work harder with arteriosclerosis. Another factor that affects blood pressure is the total blood volume. And the basic relationship that's straightforward and that you need to appreciate is that if you have an increase in blood volume, all other factors being constant, that will cause an increase in pressure. Likewise, if you have a decrease in volume, you have a decrease in pressure. Diuretics work to reduce blood pressure by reducing blood volume, fluid volume, or the fluid load. So there, the idea is if you decrease blood volume, that leads to a decrease in blood pressure. And some patients with hypertension respond very nicely to diuretics to control their blood pressure, water pills. So the basic relationship, again, that you need to remember is if you have increased blood volume, that leads to increased blood pressure. Other factors remaining constant, and vice versa. Okay? Blood volume. If you lose blood volume, what happens to your blood pressure? It goes down. So you need to stop the bleeding before the blood pressure crashes. Next slide, we'll do a few more. So viscosity of the blood. This is the thickness. So blood can get thick and thin, but it's not getting thinner again by the use of anticoagulants. Dehydration is the main factor here for viscosity. And if you become dehydrated, you have lost water, and the blood cells in the blood become more common as the plasma is reduced. So what would happen to the hematocrit with dehydration? Would it change? If it does change, how does it change? I mean, why? So, explain. So think about that. Dehydration, blood gets thicker, it's harder to pump thick blood through the vessels, so that's going to drive up blood pressure. If you're dehydrated, the only thing you can do to fix that is to drink water. And that dilutes out the blood. It literally now becomes thinner, less resistance, and blood pressure can go down. Again, all other factors remaining constant. So we're not doing anything else other than just changing the viscosity of the blood. And I have a note here for you to search in your book. And if you do this in Learner, it's really easy. You open Learner, you click on the Learn tab right there at your dashboard. It opens up the textbook. Just find the magnifying glass and type in polycythemia, and it'll shoot you to those spots in the book where polycythemia is defined and discussed. So I'd like you to do that so that you have an idea what polycythemia is, and it's in relationship here to viscosity. Another factor that affects blood pressure is the length of all the blood vessels. The more blood vessels the heart has to push blood through, the harder it has to work. And increased length equals increased resistance. It's like if you put a garden hose up to the water faucet and the hose was 20 feet long, that's a relatively short hose, you'd have pretty good pressure coming out the other end. There wouldn't be much of a reduction from the faucet to the nozzle. If you increase the length of that hose to 300 feet, you want to get out to the back pasture, then the pressure is going to go down. If you started with 100 psi or pounds per square inch at the faucet, by the time you went out 300, 400 feet in the garden hose, it would be pretty low. I don't know what it would be, maybe 5 or 10. It would be just sort of oozing out at the end of the hose. Same idea with the blood vessels. And practical implication of this, obesity is a national epidemic, and with added, so we have problems of hypertension in our population. Added pounds, you have to supply blood to the extra pounds. That increases the length, that increases the resistance, and that increases the blood pressure. So it's one of the first things that patients with hypertension are advised to do, is to drop some weight. It's beneficial for lots of different reasons, this just being one of them. And again, I'd like you to go back to OpenStax and search for angiogenesis. Okay? The last factor that affects blood pressure on this next slide is probably the one that's perhaps most important, in that this is the first 5 factors that we looked at: compliance, total blood volume, viscosity, and total length. Those considerations don't change much on a minute-to-minute basis. You're not adding or subtracting blood vessels minute by minute, nor is your viscosity or the blood volume or the compliance changing that quickly, that rapidly. But the last one does change very rapidly, and this is blood vessel diameter. So the idea is that as you decrease the diameter, or vasoconstriction, you are literally squeezing the blood. The blood can't go anywhere. It's in a closed vascular system. And if you squeeze the blood vessels, the pressure goes up. Okay. It makes it harder to pump the blood through those compressed blood vessels. And the degree of vasoconstriction, or the change in diameter, has a large increase on resistance to blood flow, and resistance translates pretty much directly into blood pressure. And it changes by a power of 4. So let's go through this and just appreciate how a small change of vasoconstriction can have a large change in the resistance to the flow of blood. And again, if the resistance increases, the heart has to beat harder and pump harder, and the pressure will go up. So let's work through this. So resistance is what we're talking about here. And that will roughly translate into blood pressure. But let's stick with the idea of resistance. And we'll let R, a big, bold, capital R, represent resistance. And the little r is representing the radius of a circle. And the diameter, of course, is two radiuses, twice the radius. So the resistance is more or less equal to 1 over the radius raised to the 4th power. Okay? So this is sort of the point of it all, is that if resistance increases, the heart has to work harder. If resistance to flow increases, heart has to work harder, creates more pressure to push the blood through those vessels with higher resistance. Next slide, let's do a couple of examples. Okay. So we're using the same relationship that we just introduced on the previous page. And now we'll just plug in a few numbers for R. So let's say if R equals 1, we're going to calculate the resistance, or estimate it. This is all relative. So there's our, supposed to be bold. And we had 1 over the radius, which in this case is 1 raised to the 4th power. Well, that is equal to, doesn't matter how many times you multiply 1 by itself, it's always 1. So that's 1 over 1. So that is equal to 1. Okay. And now let's look at it if we change the radius. So here we are doubling the radius. So we went from 1 to 2. So let's do our example again. And we have 1 over 2 to the 4th. And 2 to the 4th is 16. So we have 1 over 16. All right. So what does that show us? Well, when we doubled, when we went from a radius of 1 to 2, the resistance dropped by 16-fold, 16 times. Conversely, if we had started with 2 and we vasoconstricted to 1, then the resistance would have gone up 16 times. So it's significant. So let's say these two examples relative to each other, this one has much more resistance. It's vasoconstricted. And that translates into increased blood pressure. And conversely, this one had much less resistance. And that translated into lower blood pressure. So vasoconstriction increases blood pressure. Vasodilation lowers blood pressure. That is a very important relationship. We will be dealing with it frequently. Okay, that's it for an introduction to these 6 different factors that affect blood pressure. So we'll come back on the next unit and look at the baroreceptor reflex, on how the heart and the blood vessels, etc., are regulated. So until then, study hard. We'll see you soon. Bye.